Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
After we have recorded and registered the patient's intermaxillary relationships, we transfer these relationships to the articulator and then develop our wax occlusal rims in the manner described in the last exercise. We are now ready to set the denture teeth. And we start, of course, logically, with the anterior denture teeth. Now, we're going to insist in this exercise that your mountings be neat and trimmed, as are these, and your articulator be free of excess wax and plaster. The first step in setting the anterior teeth is to locate the midline on the wax rim so we can line the central incisors in such a way that the midline, of course, is correct. This is done in the patient by using the face. And although there is asymmetry in all patients, we have guidelines such as philtrum of the lip and so forth to determine the eventual position of the teeth. On the articulator, we have to do this a little more arbitrarily so that everybody has the same midline. I suggest this method. We'll take the pin, incisal pin, and raise it, and then twist it slightly so the beveled edge is in line with it's twisted at right angles, you see, so you have something to sight down. And then lining up the top part of the articulator with one eye, we drop down, sight through on the same line, and mark the cast. And at the same time, we will mark the wax rim for the midline. This is just an arbitrary method in the laboratory. Now, sometimes there are people who will use the papilla, for instance, as a guide to the midline, or the frenulum. But this isn't always a good guide. As you can see in this case, I've just made a small line. I haven't lined it up yet perfectly, but it looks like the midline is going to be a little bit to one side of the maxillary anterior frenum. And this is sometimes the case. So I'm going to put this toward me for just a second until I mark the midline on the cast using the methods just described. And now you can see that when this articulator is centered, that I have indeed made an arbitrary midline. Now, this midline should be carried down onto the wax, of course, because this is where the teeth are being set. So the next step is to open the articulator and actually scribe a line. I'll scribe it first using my eye and then let you see what I've done. I'll scribe it using a knife and then let you see what I've done. Okay. Now again, the wax is marked so that we are in the midline. Now, the next logical step, of course, is to go to the mandibular. So we'll just keep that line going and line up another mark on the lower wax occlusal rim. So now we've scribed a line which shows the midline of this particular case for anterior tooth setting. That's the first step. And don't forget to put it on the cast because the wax is removed as we set the teeth and we don't want to lose the midline as we set these anterior teeth. Now, as the first actual step in setting the teeth, we remove a section so we have room to set the teeth, and we remove a section from the midline to the bicuspid area on one side. Now, when we set teeth, it's advisable not to set the teeth into a mass of wax. We're using the bite rims as a guide for setting teeth, but not necessarily to set the teeth in the rim. Now, sometimes this is done, but It makes it very difficult to wax the denture at a later stage. So I would advise this procedure where we actually remove the wax rim in a certain area and then set the teeth directly on the base plate using some excess wax. Now in this first exercise we are only setting the anterior 12 teeth. That means 3 on the side where I'm working now, so I'm only going to remove the rim back to the area of the future bicuspid. And the reason for this should become pretty obvious, and that is with the pin out of place, we want to maintain the vertical, so we leave part of the rim in the posterior area, and then when the articulator is closed down and the pin is not in place, we still have our vertical maintained, you see. Now that's the first step. We remove the wax and we do not set these teeth in the large mass of wax. Now before we set a tooth, just let me make a comment or two about the teeth that we are using for the course. You all have purchased a package of the teeth, and this time we're only interested, of course, in the anterior teeth. They come on a card with wax in it, and I would advise that you keep this card because we are going to make 2 setups. And when our teeth are removed or they're sitting on a bench for any reason, as you adjust them, make minor changes and so forth, it's always a good idea to place them back on this waxed card. Okay, so don't throw these away. This is just a plea to keep the cards so when you change teeth, you can keep them in order and so forth. Now the first step in actually setting the teeth will be to set the central incisor. And as you might have noticed, when I was removing the wax, I had a very thin area on the base plate. As a matter of fact, one area had actually broken through to the cast itself. Now it's important, as you remember, not to mar or scratch this cast in any way. But in this technique case, we have found that it is a good guide. Everybody will have the same setting. If the small pins on the back of the tooth actually rest against the stone or close to the stone of the master cast. In other words, those of you who have used too much blockout will find that your anterior teeth, when set on top of the base plate, will be too far to the labial. And what I'm suggesting, with the hot spatula, so you can't harm the master cast, you actually make a space and melt the place through the base plate so you're very close to the stone. And those pins on the tooth should rest very close to the stone itself. Now the first step in placing the tooth, of course, is we have to make it fast in some way, so we'll just add a little bit of wax in this area, molten wax, and then make the initial attempt with the tooth. Now, as we've discussed in the lecture and as written in your handout, the requirements for the central incisor are that the incisal edge will be 1 millimeter below the plane of occlusion. So the first setting is just that, it's the first setting, and I'm sure I'll have to make some adjustments, but just to see if we're in the ballpark here or not, I'm going to make an initial setting of the tooth and then look at the symmetry from all angles and determine what the next step should be. Now at this time, in its initial setting, I've made a couple of errors. One is that the tooth is not in the proper axial direction, you see. It is leaning toward the distal. The incisor is leaning toward the distal. The 1 millimeter below the plane of occlusion, and we will use the lower plane as the plane of occlusion throughout the tooth setting. I am about 1 millimeter below, so that is correct. And then the third thing to look for is we open the articulator and look directly down. We want the incisal edge of this tooth to follow the contour of the wax rim on the other side. You remember, this was developed theoretically, and it will be in the clinic, it was developed in the mouth. So we have the contour, and we want to use that as a guide. So if your tooth is set like this, which is very easy to do, we have a correction to make. We follow the contour. Now some of you will have the tooth too far to the labial if you're on your base plate. We've mentioned that. Now if your pins are on the stone cast or very close to it through the base plate, and you find that your wax rim is too far to the lingual, say, this means in this particular exercise that you have constructed your wax occlusal rim too far to the lingual. Because this is a self-limiting item in this exercise. In an actual case, you would definitely follow the rim even if you had to grind on the tooth. There should be no necessity in this course for grinding on these teeth at all. Okay, now for the second step, I'm going to take that tooth off for just a moment and go back and make the corrections that I talked about and see if I can complete setting this first central incisor. Now it's obvious that I have the lingual or the mesial edge next to the area of wax that I cut out, so indeed it is in the midline. Now I want to remind you at this time what is mentioned in the handout, that is, don't use the red utility wax to set the teeth. We will use the pink base plate wax for the entire setting of these teeth. Now I'm looking at this myself in several different directions, and in a moment I'll show you exactly what I'm looking for as I get this central in a satisfactory position so we can go on to the next teeth. And at this time I'm going to use a little more wax, being careful not to use an excessive amount of wax, because these dentures do have to be waxed to look aesthetic before they are processed, and if we have too much wax, it's as much of a job to wax the denture as it was to set the teeth, and that shouldn't be. Okay, now I think that at this point we are ready to take a more critical look at this tooth setup. At this point, the axis of the tooth, the vertical axis, is correct. The incisal edge should be parallel with the occlusal plane. But you'll notice at this time that I have dropped the incisal edge down about 1 millimeter. So actually it extends below the plane of occlusion 1 millimeter. And that is correct. Now as I turn the articulator around, another item that I'd like to point out is that you can see some developing horizontal overlap. This is what we talk about as overjet. And when the lower teeth are set where the wax rim now exists, we will develop this millimeter over jet. 1 millimeter over bite, 1 millimeter over jet. One other thing I'd like to point out, and I might be a little bit to the labial, but it's close, I think. You'll notice on the tooth that you have, there's a flat portion forming the part of the incisal face of the tooth. This should be in the vertical direction when the tooth is set. In other words, these teeth do not have a sharp labial inclination such as my pencil is in right now. The only tool adjustment that I can see at this point to make on this tooth is to make that labial surface just a little bit more vertical and to bring it down, the whole tooth down just a little bit, so I have indeed developed a little more vertical overlap or overbite. And at this point I would consider the first tooth set correctly and will now go to the lateral. As we have talked about in the lecture and in your handout, the lateral incisor has a couple of characteristics different from the central incisor. One is that the incisal edge is placed at a level of the occlusal plane. So we can use the lower wax occlusal rim as a guide and set the lateral so the neck is depressed slightly and the incisal edge is even with the occlusal plane, which of course makes it 1 millimeter above the incisal edge of the central. So at this time we will remove the green wax from the tooth and set the lateral incisor. As I said before, there's no need to grind these teeth if they're set correctly in the setups that you have. Now the teeth that you have lots of character to them. They're not like denture teeth that have been used before. They have, they're selected from a mold of teeth made by the True Bite Company in York, Pennsylvania, called BioBlend teeth. They look very natural. They have character. You'll see the check lines in them and so forth. I'm depressing that neck slightly. At this time I won't do any waxing because it adheres fairly well. But as we take a look at this, you can see two things. One, in this view, you will notice that the incisal edge is at the level of the occlusal plane, when at the same time the incisal edge of the central is a millimeter below. That's the first thing. The second thing is that as I rotate it slightly, I'm trying to show that the neck of this tooth is slightly depressed when compared with the central incisor. These are characteristics of lateral incisors in dentitions. Now, to make that adhere a little bit better, even though these lights are warm and I have no trouble at the moment, I'm going to flow just a little bit more wax around the neck of the lateral, trying to keep the wax off the surfaces of the teeth if I possibly can, because it all has to be removed eventually, so don't get wax up under the surfaces of these teeth. And if that pin on the lingual surface is covered with wax and allowed to cool, the tooth will have enough adhesion. It will stay in your setup. Now the third tooth, of course, is the cuspid. And the characteristics of the cuspid in setting teeth for the denture are that the incisal edge, again, like the central, is placed to be 1 millimeter below the occlusal plane. The second characteristic of the cuspid is that the neck is prominent and leans slightly toward the distal. Now this supports the corners of the lip and is a very important tooth. When people lose cuspids, it usually makes a difference aesthetically. So the cuspid tooth on a denture is a very important tooth. Now you'll notice, and you can see it on the teeth that you have in your kit, and look at it when you get the tooth out. You will notice that there are two directions in the incisal portion of the cuspid tooth. The mesial edge, the incisal edge of the cuspid, should be in line with the other two anterior teeth. The posterior incisal edge of the cuspid tooth, we line that up so it twists slightly to the distal and actually forms the first part of the line down the ridge, which forms the line for setting the posterior denture teeth. And when you get your teeth out, take a look at the incisal edge of the cuspid and you'll see these characteristics that I've just described. It shows it very nicely on this particular tooth. This tooth also, if you pay attention when you look at your own teeth in a few moments in the laboratory, you'll notice that there is some incisal wear placed on the tooth. It looks very natural for certain types of people to whom it would be selected for in the actual case, and it already has the incisal wear. At this point, this is just an initial setting, and I'm sure I'm going to have to make some minor adjustments in a moment. But at this time, the incisal edge is, again, slightly below about a millimeter below the occlusal plane, and it is also in alignment with the other two teeth. Now I'll open the articulator and we'll look directly in at the upper arch. And at this point you can see that the symmetry on the side where we've set the teeth matches the symmetry on the side where we still have our guide, we still have the occlusal plane. Now see how prominent that the neck is of the cuspid tooth. This is characteristic. Don't depress this neck. The lateral is slightly depressed, and the labial surface of the central is in the vertical plane. Now once again, so we don't lose the tooth, simply put a little bit of warm wax around the neck of the tooth, keeping the wax off the surfaces of the tooth, the labial surfaces of the tooth. And at this point, that's all the farther we will go in the waxing of the denture. Just enough wax to hold the teeth firmly in place, and that's all. Now this completes the setting of the maxillary 3 anterior teeth. The next step, we will remove a block of wax from the lower, the same method used for the upper, and we shall demonstrate setting the lower anterior teeth. In setting the lower denture teeth, the first step is the same step that we used for setting the upper. That is, we remove a block of wax in the lower area back to the approximate bicuspid area from the midline over. We're using the midline as a guide, of course, so we maintain that midline. And then our central incisor is set so that it follows the contours again of the rim, which is being used as a guide, and it also has a couple of other characteristics, and I'll point those out in just a moment once I get this central incisor set correctly. I'm trying to line it up so it is in the symmetrical with the other part of the wax rim that has not been removed yet. That still acts as a guide. And when we finish, we should have some labial inclination to this lower tooth. And also, the incisal edge, no, I think that's arranged correctly. The incisal edge should be even with the occlusal plane, or the lower rim. All of the lower teeth will be even with the occlusal plane. And then it has a labial tilt. You can see that as I rotate the articulator. Then when the articulator is closed into place, we have our millimeter, or possibly a little more depending on the case, of horizontal overlap or overjet. You can see that very clearly in this picture. We do not lock anterior teeth in the denture. They do not contact in a denture. Now looking straight in like this, you can see that because the lower incisal edge of this anterior tooth is even with the occlusal plane, and the maxillary central was set a millimeter below, this generates our 1 millimeter, arbitrary 1 millimeter vertical overlap or overbite. So these are the criteria for setting the lower anterior teeth. And at this time, using the same guidelines, I'm going to go ahead and set the lateral and the lower cuspid. Now I have gone ahead and set the lateral incisor and the lower cuspid. And at this time you'll notice again the incisal edge of the lateral and incisor are even with the occlusal plane. Now the cuspid tip may be slightly above the plane. Maybe slightly above the plane, but you'll notice that the incisal portion in the mesial and the distal is below, just at or below the plane. Now when I close the articulator at this point, let's look at the features that we should see at this time. One is that we have our millimeter overjet and overbite. In the central incisor we have the 1 millimeter overbite. But because the maxillary lateral, the incisal edge being set at the plane of occlusion, the same as the lower incisor set at the height of the occlusal plane, those teeth should be end-to-end, and indeed they are, as you can see. Again, as we go around to the cuspid teeth, we once again have the overlap, the vertical overlap or overbite. And here again, we're talking in terms of a millimeter only. And as I tip this up, this emphasizes the fact that anterior denture teeth are not in contact. We do not lock in the denture. And you can see, as guided by your well-adapted occlusal rims, we end up with the space between the teeth at the given vertical. And this is what we want to accomplish. Now, a couple features of the lower cuspid. Let's take a look in the axial direction, and we'll begin to talk a bit about our posterior setup at this time because it influences the way we set this lower cuspid. Now, you will notice when you look at your cuspid that the lower cuspid also has two angles of the incisal edge. It's not straight across such as the incisor teeth are. The distal part of the incisal edge of the cuspid tooth is slightly twisted to the medial portion of our case, and actually it is aligned with the center of the ridge. And you see the mark on the back of the cast here. What I've done when the base plate was off, so I've made a mark all the way along the top of the ridge, and that will be a guide to the central fossa of the lower posterior teeth when we set the posterior teeth. And that will be demonstrated separately. But at this time, the central incisor, the lateral incisor, and the medial portion of the incisal edge of the cuspid tooth are in alignment in the contour, the configuration of the symmetry of the other side of the wax rim. And the cuspid, again, is twisted slightly so that this portion lines up with a line, and we can extend this right into the wax, make a groove in the wax that represents a line over the residual alveolar ridge, and that's aided by aligning it with the mark that we've made on the back of the cast. So that will be a starting point when we set the posterior teeth. At this time, to complete the anterior setup, once we are satisfied with the arrangement of these 6 teeth, we simply go to the other side and, starting by removing the wax on the upper, go through the same procedure that we have just demonstrated and complete the anterior setup, all 12 teeth. And at that point, when everything is in order and you're satisfied that you have them set correctly, not until that time will we set the posterior teeth. So this completes the setting of the anterior teeth for the complete denture.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.